May is Mental Health Awareness Month, and the American Foundation for Suicide Prevention has a new campaign called Talk Away the Dark. And my guest this morning here on Jersey Magazine is Vic Armstrong. Vic, good morning and welcome.
Good morning. Thank you for having me.
How common is suicide these days? I know the numbers have gone up a little bit, but how common is it?
2022, we saw about 50,000 lives lost to suicide. We know even one is way too many, but we did see about a 3% increase from 2021 to 2022. So we know that suicide is a public health issue, is one that impacts all of us, but it's also one that we believe is preventable, and that we believe that the way that we help to prevent suicides is by raising awareness and by teaching people the risk and warning signs.
And tell me about the Talk Away the Dark program.
Yeah, Talk with the Dark. It is a program that depicts a conversation with someone who is experiencing suicidal thoughts, but they're not openly talking about it. And it really demonstrates how you can have a caring conversation with that person and then connect them to help. We also have in that same space, along with our Talk with the Dark campaign, we have our Real Convo Guide. And the Real Convo Guide gives us step-by-step instructions, tools for starting and continuing a conversation about mental health or suicide awareness. And we've even upgraded our Convo Guide so that now we include resources on how you talk to someone if they are hesitant about seeking help. So if you're having conversation with someone and you get pushback, as you very likely may, when they say that I don't want to go to therapy, I don't want to be hospitalized, I don't want to be put on medication, how do you have conversations with people to ease their fears and encourage them to seek help? So you can find all of that on our website at afsp.org/talkawaythedark.
In addition to what you just mentioned about, I don't want to go to therapy or what have you, is no, there's nothing wrong with me. I'm fine. I'm just down today.
Yeah, and so there are things that we encourage people to look for in terms of warning signs, because oftentimes people will say, and they'll say things to deflect. But if you see warning signs, like if you see changes in their mood, changes in their behavior, changes in the way that they talk, we encourage you to be very seriously, very carefully, concisely, and clearly ask them if they are thinking about suicide, or ask them if they're struggling. And those warning signs, if you see someone who's talking about suicide, or talking about not wanting to be here, or talking about wanting to end their lives, then that is cause for you to want to reach in and have those conversations with them. And even when people are saying that I'm okay, I don't want to have the conversation, you're still creating that connection. People who are experiencing suicidal desperation have often lost hope, they've lost social connection. And so you begin to create that space. One of the things that we do encourage people, though, is that when people do say that they don't want to engage in conversation, you want to respect that person's feelings, but you also want to make sure that you leave that person safe and in good hands. So if you continue to have concerns about that person, even when they say that they're okay, you can encourage them to call the 988 hotline. You may want to stay on with them while they have that conversation to talk through it with someone. Or you may just want to say to them, well, let's talk about what's going on with you. I noticed, even they say, I'm okay, I noticed that you were crying earlier. Or I noticed that you don't come around as much as you used to. What's going on with you? Let's have that conversation. As you begin to have those conversations and listen and allow that person to talk about what's going on with them, they may open up and begin to share about where some of their challenges are. And you may be able to get that person to seek out help. But it begins with really having open dialogue and being willing to listen to that person.
I think one of the things that also may prohibit someone from opening up a little bit is, well, nobody feels the way I do. I'm the only person who's gone through this. And yet, when you do open up a little bit and you start speaking with someone, you realize, wow, maybe this problem isn't as bad as I thought. And B, I'm not the only one.
Yeah, that's part of normalizing the conversation. There are a lot of people who experience suicidal thoughts. People don't realize that it is much more common than we think. A lot of people have suicidal thoughts, but most of the people that have suicidal thoughts do not go on to die by suicide. And so having conversation with people that normalizes conversation, yes, it can help them to realize I'm not the only one that feels this way. And in having that conversation, you also let them know you are not alone. I'm here with you. And when you normalize a conversation by saying things to them like, I noticed what's going on with you and I'm here for you. I want to help you. I'm validating your feelings. That helps that person to be willing to connect, to be willing to open up. And it is very true. There are a lot of people who go through this, and we want them to feel like this is just like if you were experiencing a physical health issue, that you can talk about it and there's treatment available for you.
How much do you think the suicide rate has been affected by COVID?
That's a great question. Here's what we know. We know that oftentimes, again, people who are experiencing suicidal desperation, they've lost hope, they lost social connection. And so we know that was a challenge during the COVID pandemic, that isolation and fear during the COVID pandemic were very, very real. But we also know that suicide is really a very complex issue. There is no one specific thing usually that leads a person to attempt suicide. It's a combination of a lot of very complex things, often including mental health challenges. So while we can't dismiss the fact that the COVID pandemic undoubtedly had an impact on the mental well-being, we don't really know the impact on our suicide rates. We have seen an increase in suicide rates since the pandemic, but we've also seen an increase in research, we've seen an increase in resources. We even created more resources that allow us to get more upstream to reach people before they reach the point of suicidality. So while we have seen some impact from the pandemic, we've also seen an uptick in our ability to address the challenges that people are facing.
Thinking personally, I have two friends who passed away via suicide. One was a drummer in a band that I was in, and the other, most recently, was someone who I had done a number of different projects with. Our kids went to the same school. We coached together. And on both cases, Vic, I didn't see any sign that would lead me to believe this person is considering this. This person is in a dark place. And I wonder, how much of those signs that you talked about a little earlier in our conversation here, how much of those signs we just miss in day-to-day living.
Yeah, it's important for us to realize that oftentimes people do reach out for help in the way that makes sense to them or the way that they know how. And it's oftentimes not in ways that we realize. And so sometimes we do not see the signs. But that's why it's so important for us to normalize the conversation. That if you have concerns, you ask if you have concerns about that person. And it's also important, especially with young people, to keep non-judgmental lines of communication open. The more that people see you as a safe resource, as a safe space, the more likely they are to tell you if something's going on with them. One of the challenges that we currently face is that there's so much stigma around suicide and mental health that people don't usually feel comfortable coming forward and talking about it. But the more that we can normalize this conversation and help people realize that mental health challenges are no different from experiencing physical health challenges, there's treatment available, recovery is possible, and we help people to know that by having conversation, by creating resources in communities where people live, work, play, and worship.
We're speaking this morning with Vic Armstrong. He's the Vice President of Health Equity at the American Foundation for Suicide Prevention. What brought you to the AFSP, Vic?
I have been in this role for about 9 months, but I've been a volunteer with the FSP for several years, probably 7 years or more. I was on the board in North Carolina as a volunteer. One of the things that started me on this journey, and it's been a bit of an evolution for me, but I was a hospital administrator some years ago. I actually ran a behavioral health hospital as part of a large hospital system. And one of the things I noticed was that there were a lot of people coming into the hospital experiencing suicidal thoughts, and there were a lot of people that were being discharged from the hospital that still were experiencing suicidal thoughts. They still had that loss of connection and hope. And it really made me more sensitive to the things that I could do to help address this. And that's really what started me on my path of really being passionate about suicide prevention and awareness. What has happened since that time, though, is as I have gotten more involved in the space, I've had family members, I've had friends, I've had people I went to school with to come to me and talk about the challenges that either they have had or a family member has had. And that has just really served to convince me that I'm absolutely in the right place at the right time, doing the right thing, because there are so many people that are hurting.
For listeners who want to learn more about the Talk Away the Dark program, where can they go, Vic?
They can go to afsp.org/talkawaythedark, and you'll find our Talk Away the Dark campaign there. You'll also find our real combo guides there that will give you the step-by-step instructions of how to talk to someone. You also, though, on our website at afsp.org, you can find resources to connect with a local chapter. We have chapters in all 50 states. We have chapters in Washington, D.C. and Puerto Rico. So we have chapters in every state, and we encourage people go to the website, connect with our chapters. They're ready and willing to engage with communities. We have resources on our website. If you're looking for resources to support you or someone else who may be struggling with suicide or their mental health challenges, if you're looking for how to get involved in your community, how to support a walk, how to find a group for other suicide loss survivors, you can find all that information on our website. We even have data, statistics on our website if you're looking for data specific to what's going on in your state. So I encourage people to visit our website, afsp.org. And again, for our Talk Away the Dark and Real Convo guys, that's afsp.org/talkawaythedark.
Vic Armstrong, the Vice President of Health Equity at the American Foundation for Suicide Prevention. Thank you so much for your time this morning and continued success with this program.
Thank you so much. I appreciate you having me.